Hi guys, Dr. Sam here, helping you get closer to your best skin day ever. Today I'm talking about don'ts in rosacea. Now, super common condition and one that causes a huge amount of heartache and distress and makes skincare shopping a little bit of a nightmare. So I wanted to cover the things that will ensure that if you don't do them, you're in a really good place to start doing the right things. So let's get started. So the first don't is don't trigger your rosacea by exposing yourself to things that set you off. Now, the way I think of rosacea and the way it reacts to the environment is a little bit like a fire alarm going off when the kettle boils rather than when the oven is on fire. So your skin reddens and you flush and potentially get a flare-up of the spotty aspect of your rosacea when you're exposed to common triggers. Now, the big environmental triggers are ultraviolet, the sun, and cold weather. So anything that makes your blood vessels either dilate or shrink and then dilate. So if you're outdoors in the cold and you come into a hot room, guess what? You're going to dilate up because your blood vessels are triggered, and that's going to cause prolonged redness and probably give you a tingly sensation too. So managing your exposure to common environmental triggers is a really big part of this disease. So what that means practically is that sunscreen is actually part of your active approach to your rosacea. So it's part of your treatment. I have a hard time convincing patients of this in the first instance, but once they get into it, they realize how important it is. So ultraviolet rays will drive your rosacea. It's also going to antagonize the aging process. And the best suited sunscreens for sensitive rosacea types tend to be those that are all minerals. So look out for ones with zinc oxide and titanium dioxide. The other good aspect of this is that they often contain a skin flattering tint that will mask some of the redness. As far as winter weather goes, you really just need to focus on protecting and shielding your delicate facial skin. So that means wrapping scarves up, wearing a hat, and generally staying cocooned inside warm clothing. Don't number 2, don't ingest things that you know make your rosacea worse. So common red flags are things like spicy foods, so curries and Mexican food, types of alcohol that are particularly provocative. Red wine is the big killer, although all forms of alcohol can actually encourage vasodilatation, so opening up of those blood vessels and therefore flushing. And for a lot of individuals, hot drinks. The question mark about caffeine was recently suggested to be less likely. There was a large study that showed that actually caffeine intake wasn't negatively correlated with exacerbations of rosacea and may even be protective. The story on caffeine is not yet fully elucidated, but I don't think there's any doubt that hot beverages can trigger a flare-up. So modify the temperature of your teas and coffees if that's problematic for you. The third don't when you have rosacea is to be careful that when you're in the gym that you aren't overdoing it in terms of your exposure to heat. Now that means being careful about saunas and steam rooms. It also means being careful about hot yoga or other forms of hot exercise, because again, anything that leads to a prolonged dilatation, which opens up the blood vessels, may potentially promote further prolonged broken capillary appearance and lead to further redness of your skin. So in general, I advise my patients to keep their steams and their saunas super brief or skip them altogether, and perhaps to do yoga at a normal temperature. Number 4, we're now getting on to skincare don'ts. Please don't product hop. Beauty boxes are not for you if you have rosacea. Rosacea skin, it likes calm, it likes consistency. Now, I'm a big fan of those things anyway, but never more so than when I'm dealing with somebody with redness-prone skin, and I count myself in amongst that group. So what you want to do are to avoid ingredients like fragrance, like alcohol, and you want to avoid overly irritant active ingredients that don't really have much upside for those with rosacea. So I think of things like alpha hydroxy acids as being a group that I don't necessarily think have a huge amount of benefit. When I think about acids and rosacea, I think positively about azelaic acid. It has far more potential benefits and will also give you the chemical exfoliation benefits that alpha hydroxy acids do. So think about swapping your glycolic acid for azelaic acid. And then the final skincare don't, unsurprisingly perhaps, is to skip physical exfoliation altogether. And by that I mean no brushes, no flannels, no gritty physical scrubs, no microdermabrasion. So things that essentially will irritate the surface of the skin. Again, rosacea, there is barrier dysfunction, the skin is naturally more prone to transepidermal water loss, and the skin is easily irritated. So bear this in mind. Don't whittle away at your barrier by using physical exfoliation. Again, chemical exfoliation will keep your pores unclogged. And I know that's a particular concern for those of you who have rosacea and acne overlap. But again, azelaic acid is going to be one of your winning ingredients in this situation. So yeah, please don't do any harm with your skincare, with your rosacea. Be kind, be gentle, skip unnecessary ingredients, and you'll be setting yourself up for a really good place to treat your rosacea properly. Now, the final parting note on this is, again, not to delay seeing a dermatologist, because ultimately rosacea can be a struggle. It can be very hard to manage it alone with just over-the-counter products. And a dermatologist who's interested in skincare is best placed to guide you on a complete approach to handling your delicate, sensitive, fiery skin. So I hope that was helpful for you guys out there with redness-prone skin and rosacea. If you liked it, give it a thumbs up, subscribe, and share it with a friend who might find it helpful. Bye for now.